Hi, my name is Jet Trianarda, and I will be doing the prenatal teaching video number 1 today. So the first thing I'll do is wash my hands, go to my patient, confirm with 2 patient identifiers, and then close the door for privacy. So I will begin by informing the patient about how these visits would typically look like. So every month for the first 28 weeks, she will come to the office monthly. And then from 28 to 36, she'll come every 2 weeks. And then after 36 weeks, she'll come to the office weekly. In the office visits, we will check her vital signs, check the development of the mother and the baby. We will check the fetal heart rate, measure her fundal height, do some labs like her CBC, do STD panels and screenings, and then check for her blood type and Rh factor. Depending on that, will determine the need for ROGAM, as well as immunization screenings to make sure that she is up to date with her vaccines. After that, we'll talk about expected weight gain, which would depend on her BMI. If her BMI is between 18 to 24.9, her expected weight gain would be about 6 to 12 pounds. If she's below 18% BMI, she would be considered underweight and she would typically gain more weight. If her BMI is above 25 and below 30, she'll need to gain less weight compared to the normal BMI of 18 to 24.9%. And if she is obese, even less than that of the overweight BMI, if she is 30% BMI and above. The typical weight gain for those that are above 25% BMI would be 5 to 9 pounds. And then we'll talk about diet. For diet, we would teach the patient to decrease her sugar intake and her saturated fat intake because of the risk of gestational diabetes. And also just be mindful or lessen the amount of salt intake or sodium intake due to the risk for gestational hypertension. The next teaching would be vitamins. It's recommended that she take prenatal vitamins with calcium and iron as a anemia prevention precaution, and then folic acid for neural tube defects prevention. For exercises, it's recommended and we advise and teach them to do low impact exercises, so walking, yoga, but no high impact exercises like running or anything that can move or juggle the baby. Some common complaints, teachings that we would like to teach the patient about would be nausea and vomiting. This can be alleviated by snacking throughout the whole day, taking in crackers, eating a piece of toast to start your day. For fatigue in the first trimester, periodic rest throughout the day just to, alleviate that feeling of fatigue. And then for the constipation, we would teach the patient to increase hydration and increase fiber intake. 3 warning signs that we would teach the patient and when they should actually call their provider would be when there's bleeding of any kind. Typically, especially if it's someone bleeding over 20 weeks, call your provider. It might be a sign of a miscarriage. The next warning teaching what we should be teaching the patient about would be hyperemesis gravidarum, which is uncontrolled emesis, which can lead to severe dehydration and severe poor oral intake, which can lead the patient or the mother to go to the hospital. And then the last one would be a placental abruption, which is characterized by increased abdominal pain and bright red blood. It can be caused by the mom's hypertension if left untreated, or trauma, which would cause the placenta to detach from the mom. That's the symptoms. After I complete my teaching, I would document that the teaching was complete, ask the patient if they have any questions, and then I would take my leave. Thank you.